All right, see people who have had work done, trying to look younger. And some results are fantastic, flawless, effortless. People look natural and beautiful, don't look like they had surgery. And others don't look great. And, worst case scenario, people can come out looking tight or off or just, a little unnatural, which is a worst case scenario in a lot of ways. So, how do you get great results? Well, it comes down to technique. It comes down to, proper diagnosis, proper planning and design of procedures, and then execution, using great technique. And so when you see a great result, it most certainly was not an accident, and it took all of this to come together to get there. So I'm Alex Campbell. I'm a board-certified plastic surgeon in Cartagena, Colombia. I run with my wife a busy medical tourism practice, premium care plastic surgery, and today we are going to discuss the Deep Plane Facelift technique, why it's better, why it's improved our results, why our facelift practice has exploded with that technique, and why me and my patients are so happy. All right, so the setup for this is aging. And when someone comes in to me looking for facial types of procedures, facial rejuvenation, I really start out with, I say, look, the bottom line of this stuff is we are trying to keep people looking younger, longer, refreshed, natural, and not operated on. Okay, so that's the bottom line. So we've got to understand, very clearly what's happening in someone's face to cause them to look, older over the years, what causes aging, and then what to do to fix it, basically. And so aging, bottom line, end of the day, the sun is shining every day, gravity's pulling everything down, and things stretch out and fall. That's what happens, for better or for worse. And so once we understand that, we can understand the techniques to fix that. And so when you talk about the face, the skin stretches and gets heavier over time, but also our deep structures, our deep plane tissues stretch and fall as well. So you'll see someone's face as they age, volume that was up, high at one point falls gradually down and forward, and they start looking more round and heavy. They start getting heaviness in the nasolabial regions, they start getting jowls, they start getting neck laxity. And that's what makes people start to look older, more tired, etc. And so, when that happens, really that's an anatomical change. And so an anatomical solution, is generally going to be the most definitive. So that gets us into lifting. When you look at facelifting and think about traditionally what happens, it's quite brilliant to make an incision around the ear that's hidden and then lift structures from there, and that's undergone a big evolution over time from people, cutting up the skin and taking that off. Good thought. The problem is skin isn't all that tough, and so if you lift the face just based on skin, it's going to tend to stretch and pull back down. And then big evolutions came in addressing the SMAS layer, the deep plane, and what we were doing for years is kind of basically tightening that or advancing it a bit, but in a more limited basis. And I was actually quite happy with my results. That's what I did at the beginning of my career. And then sort of the deep plane, came around, the deep plane technique. And in 2019, I went to a conference. I saw a guy named Tim Martin, who's a brilliant facelift surgeon, who's I think really pushed this technique forward, and he presented the technique. And it was just a bit of a breakthrough. I could just see the depth of the anatomy that he was exposing and addressing, and it made a big difference. It made a lot of sense. And so I started getting into that technique slowly, and then quite quickly when I saw the results went to that nearly 100%, and we've just been thrilled since. So we're 6 years in, maybe 500 some cases of deep planes. And like I said, I've just been so happy with the evolution. And so what is the difference between a deep plane technique? Okay, so your face is in layers, right? So you have the skin on the outside, think of that as like the wallpaper, the covering. And then you have your structure, which is the architecture of your face. And that lives in the deep plane, which is the SMAS layer, all right? That contains like the facial muscles, the deep facial fat compartments. And so that's the structure of our face. And so as all that descends, the structure of the face changes. So if we want to restore a patient's youthful look, you want to restore that youthful structure, then you need to reposition those elements basically to where they were, which is how I look at this. And so, if I would say my philosophy on facelifting or deep plane facelifting is essentially to be able to control the anatomy, to move it back to where it was, fixate it there so it stays and lasts, and then remove all the extra tissue that comes with it. And that literally takes the tissue back to its prior position. You should get a more youthful result. They should look just like themselves but younger, and not have any of the, sort of complications or telltale signs of stretching and things that can happen after facelift. So when you do the deep plane, so why do it or not do it? Well, you do it because it's more powerful and it's better technique, is why I would say. I think I get better everything with deep plane results. Why not to do it is because it's difficult, quite frankly, and it's difficult to learn and it's difficult to get good at. Facelift is a high stakes procedure. It's kind of challenging to get people to put their trust in you to do their facelifts, especially at the beginning of your career. And it's relatively of a newer technique, so it's hard to get experience on. But I'll tell you, like any meticulous sort of challenging technique, once you understand it, you can kind of unlock it. So the challenge of the deep plane lift really is once you lift that deep plane to move it, there are a lot of ligaments that you have to release as well, that free it and allow it to move. The challenge down there is you're right next to all the deep, integral structures of the face. The facial nerves are right there, the vessels, the parotid gland, the deep facial muscles, etc., are all there. So if you were in that area and you do not know exactly where you are and what you're doing, it would be quite easy to injure some of those structures. And then you get dreaded complications like facial paralysis or vascular insults or other that could lead to real problems. So, a lot of people are going to shy away from that, and just use a more predictable, easier method, and that's fair enough. But again, once you understand the deep plane technique, and we're operating around those structures every day, you can be very careful. You're out of trouble all the time. I've never had a permanent nerve, injury, and then you can get the power back out of the technique. And so, what do we really do, or what really determines the result? Well, the whole thing, When you design an operation and execute it in a facelift, you've got to design the incision correctly. You've got to take into account the patient's hairline, etc., so that you design that so it hides in normal creases and in the hair. The patient's expectation nowadays on a female patient, young, beautiful female patient getting a facelift, is she wants to wear her hair up in a ponytail. She doesn't want anyone to see her scars. And so that's what you've got to deliver with good incision design. Then we've got to determine how much of the skin we lift. I generally lift all of this skin up so that we can get a correction all through, above, down, and below the face through the neck. You've got to determine whether you're going to do the central neck or not. In most patients, a central neck tightening through a small incision, tightening of the muscles, sometimes some fat removal here, is helpful. In others, it's unnecessary, but that's something we've always got to be thinking about. And then when we lift the deep plane, that's a little different from everybody as well, right? Because people's faces are different and they age differently. So some people have a really heavy neck, not so bad of a mid-face. Some people's mid-face is really droopy while their neck's not so bad. Some people, everything's down, etc. And so that will be a deep plane facelift, but our vectors of pull and how much we're pulling in a certain area is going to be, tailored to those specific things. And then after that, we've got to determine our vectors that we're going to lift the face in. Generally nowadays, we're doing more of a vertical vector, basically that brings the volume a little more up rather than back, which is a more natural restoration. We've got to decide, how we're going to fixate that in a way that is smooth and natural and long-lasting, because we want those results to last for a long, long time. And then we've got to redrape the skin so that all looks smooth and transitions between all the elements of the face naturally and harmoniously. We always talk about deep plane, that you lift all these structures and fixate it, but that brings all this excess skin. So we remove a lot of skin in a facelift, but everything is supported on the deep plane. So all of those elements really from, top to bottom in an operation are going to determine the outcome. You've got to get it all right to get it looking perfect. And then on top of that, we always look at volume. People lose fat in their face over time, so we include facial fat grafting as an automatic part of a facelift. It's not an extra charge or anything, because I want to use it, with people when we need it, which is most of the time, to soften some areas that have volume loss as a filler. I'd say it's like we're airbrushing the result a little bit. And then I think the final thing to do is to also consider other parts of the face. I always say it's not, I don't think it's helpful to say, hey, you'd be happy if you did your nose or whatever. But when we're talking about, facial rejuvenation, people generally want to look younger. So a lot of times if you've got a lot of changes around the eyes that are taking away from the look, it's helpful to consider those in a patient. Do they need eyelid surgery or benefit from eyelid surgery to give a harmonious, top to bottom result? But, it really takes an eye for that, some experience, and really a lot of just patience and consideration and caring about what you do, I think, to get these results optimized. People always ask, what's the recovery, after facelift? It's not terrible. It's a surgery. We do it under general anesthesia. It's generally 4 hours or so. So we're pretty efficient. If we do the eyelids and other things, we operate in teams. So it remains 4 hours, so that we find that people generally bounce back quite quick after that. They're in the recovery room for a few hours, 2-3 hours maybe on average. We put a wrap on, and then we generally get people home. And here, that's generally in our accommodations, our recovery suites with private nurses and full support, for after surgery. But facelift patients are up the same day as surgery walking, certainly the next day around, and I'm bringing people back 2 days after surgery to the office to get their wrap off and get the little drains out. So you're out of the house and down to the office within 48 hours, after one of these when you have surgery with us. So, that part's pretty quick. People are, getting sutures out 6 days, staying with us maybe a week, 8 days after surgery. And by that time, they're still bruised and beaten up, but generally they're kind of going out to eat and doing, mild tourism things. So the general recovery is pretty quick. One of the main things we got to think about in lifting is appearance though. So I say expect to look weird for a week, less weird the second week. By 2 weeks, generally kind of public ready, not looking like you had, work obviously done, but you'll still be puffy, for a bit. And so we'll still see all that in a couple weeks, 2-3 weeks after surgery. And that, gradually fades away, 6-8 weeks, something like that, to we're kind of getting, the final kind of result that we want. So, at the end of the day, I think people are coming in to look younger and fresher and kind of reset things because they feel young and they're bothered by the changes. And so, a well-done deep plane facelift is a powerful, powerful tool to reset the anatomy, reset the clock back 10-15 years as well as someone's look and have them, looking as good as they feel, basically. So that's it. I think those are the main thoughts for today on deep plane lifting and some facial aesthetics and philosophy, etc. So thanks for listening, thanks for joining us, and catch us here next time for more thoughts on the next subject.